All right, looks like we've got quite a few more folks logged in, so I think we can go ahead and get started. Hope everyone had a great holiday weekend, and back at it today to talk about our COVID recovery activities. Our agenda, I didn't receive any additional items to add, but not sure if anyone has anything. Feel free to put a message in the chat or wave and let me know. So today we've got Steve doing data, and now that it is June 1st, Steve is actually our incident commander for COVID. So after Dr. Velasquez reports, Steve will be back for general reports, and then GSI, and then we can wrap up with any discussion. So just a reminder to mute if you are not speaking, and I think we can get started with Steve with data. I think you're muted, Steve. Okay, Steve needs to log off and come back in. So GSI or Dr. V, do you want to, Velasquez, do you want to report while Steve does that?
Carrie, you want to go first? Because I want to go after Steve's numbers.
Oh, no problem. No problem at all. And really all we have is reminder, we have the vaccination happy hour again tomorrow. Partnership with Department of Health and Regional Health District and the ARENA PFD. So excited about that. We went to, Kelly Hawkins and I went to the last week's event. It was definitely a little bit of pickup of traffic at 5 o'clock. So the 5 to 7 is the hours for the vaccine happy hour. They'll be this Wednesday, next Tuesday, and the following Wednesday. So it'll be June 2nd, June 8th, and June 16th, just as a reminder. And just a little personal news is that this will be my final meeting here. I am moving on from GSI, and my last day is June 11th. But just want to share, it's been, unprecedented. It's been a pretty incredible last 16 months or so, and have appreciated this forum and really the collaboration across these channels during this really challenging time. So that's about it, unless Alicia had anything.
I don't. Good morning, everybody. Just getting kids out the door for school. Nice to see everybody.
Well, thank you so much, Kara. You have been steady and a constant through all of these meetings, and really appreciate your work. Sad to see you go, but I know you'll do something great where you go next. And hearing a lot of positives about the happy hour event in the community. So great partnership and great work. So thank you so much.
Thank you.
Looks like Steve is back. You want to try it again, Steve?
All right. Is this working this time?
All right. There we go. Yep.
There we are. 3-day weekend technical difficulties, I'll say. All right. So just a brief disclaimer on the data. There's kind of two things going on this week as I describe it. One is that given the 3-day weekend, we did not update data over the weekend. So I did move it back by just 1 day of what I usually report. Also, in addition, as many of you have heard, we are going through a pretty significant backlog with the data. The Department of Health, through some issues that were going on with a couple of providers, had a large backlog that dumped data last week. So between May 20th and 28th, 615 at least of the cases that we reported were backlog data. I did include those in there, but that's about 41%. So I'll kind of explain what that means in context. But for the week of May 22nd to May 28th, we had 1,145 new cases. There were 867 reported the previous week. That moved our daily average up to 164. It was 124 the week before that. So for our 2-week total, we were at 2,012 cases, which put us at a rate of 385 per 100,000. The week before it was 311. Now, if we look at those cases that we had backlogged and kind of adjust for that, it doesn't really look like we are rising as much as it would show currently. We're either plateauing and slightly declining in cases. That said, of the cases that were reported last week, still the common folks that were driving it, 20% for 20 to 29-year-olds, 18% 30 to 39-year-olds, and 16% for 40 to 49-year-olds. There's also a slight decrease recently in the 10 to 19-year-olds, which is great. For our hospitalizations, we had 32 new Spokane County resident hospitalizations during that period. There were 38 the previous week. It's been slightly declining the last few weeks. That puts our 7-day rate at 6.1. It was 7.3 the week before that. Currently hospitalized as of the 28th, there were 73 Spokane residents and others. Unfortunately, last week we did report 10 new deaths, including 1 individual under the age of 10 years old, 4 individuals in their 70s, 1 individual in their 80s, and 3 over the age of 90. There were only 2 deaths reported the week before that. So for our testing remains pretty steady. We had 5,236 molecular tests conducted here in Spokane County last week. That puts our average number to 748 per day. That's down just slightly from 860. And our percent positivity continues to increase to 13.2%. It was 12.2 the week before that. For the healthcare system readiness, there are currently 1,100 staff beds, 1,501 licensed beds. Occupied census for staff beds is at 88.2%. That's 64% for licensed beds. Our total COVID census was 6.7% for staff beds and 4.9% for licensed beds. And our ICU remains right around 90% occupancy. Our vaccinations, and this data is up to date to the 26th. We have given 371,789 total doses. That puts our percent of people initiating vaccine to about 40%, or 208,937 individuals. For those over the age of 16, that's about 50%. And then 34% of the whole population has initiated vaccination, and about 43% of the population 16 and up has initiated vaccination. And that concludes my report because we didn't have anything to update from over the weekend. If there's any questions.
Questions for Steve on the data? All right, Dr. V, if you want to hop in, sometimes questions on data come up as we go through, so you can go ahead.
Good morning, everybody. I hope we had a good weekend. It was a beautiful weekend. I spent most of it outside, so I'm tired today. What can I say? But a couple of things before I have 3 things to update you on, but I wanted to comment on the numbers. It is a little bit unfortunate that the numbers are a little bit difficult to understand because of this backlog, but the good news is, as Steve mentioned, if we sift through that, it looks like we're starting to head in the right direction, which is what is important. So we got to keep moving in that direction. And as he mentioned, about 50% of the eligible population has at least initiated. So if we keep moving in the direction that we are, that 70% is something we can attain. And I do have a feeling the state may get there before we do. Just if you look at the average for the states, it's higher, it's about 11% higher. But I do believe that Spokane County will get there too. Maybe a little bit later, or maybe right in line with the 30th, but it doesn't really matter as long as we get there. So I do want to say that, and I do want to thank you, all of the partners that are working on every initiative that we can think of to get people immunized and providing access in different places. So if any businesses do want a clinic that can come to their sites, please let us know. We have some partners that are helping with that, and we want to make sure that access and or timing of immunization is not an issue for anyone. So please let us know. And I know that Mayor and I talked about that a little bit last week because she had some questions. So hopefully we can get some of those businesses connected with us so we can help them immunize. Because by now, a lot of the people that would like to get a vaccine are also working. So obviously staying in the job for them is very important. So later hours or convenience is becoming more of a key factor. So we're trying to do as much as we can with later hours and convenience. We also ask the mass vaccination site if they could flex their schedule. So hopefully we'll hear from them this week. And in the meantime, we do have resources through our partners to deliver in if we have sites that may want to host a clinic. So I just wanted to say that because we're doing well. We're steady. We don't go really, really fast, but we go steady every day. And it doesn't really matter whether we go steady every day or we go really fast. As long as we get there, that's the goal. So I'm very happy with that. And I do want to say thank you to everyone. So within the context of vaccines, today I'm actually doing a Q&A that will be filmed with some Eastern Washington students and Dr. David May, the interim president, aim at college and the age group within the college range, and it's all about immunization. So I do appreciate that opportunity. I think that will be good because we do have a lot of younger people that are eligible right now that we want to get immunized over the next several weeks, months as we go forward. And I also have this, I will be participating this Saturday in LAKE Buena 95.7 radio doing kind of a Q&A, which I'm going to have to practice my Castellano, which means Spanish, because they want me to do most of it in Spanish, and I haven't done that in about 1,000 years. So it's, when I go to Spain, people tell me you speak Spanish with an American accent, and when I speak English, I have a Spanish accent. So it's a very international thing. What can I say? But that is important because we will have a clinic the following Saturday, aim at the population that is listening to 95.7, and we'll be there too, just to make sure that we can encourage folks to get immunized. And these are some of the other efforts that are happening. And the reason why I bring it up is because there's a lot of efforts with a lot of partners in the community utilizing everything we can. Every means of communication, social media, radio, newspapers, but it doesn't really matter as long as we get folks immunized. So the second thing I wanted to update you on is our efforts on education. We have started transition from the academic year to summer activities. We have provided training for prospective camp directors, summer camps. And we're approaching summer camps from two different venues. One is with our education team, because many of them are related to schools or educations of institutions of education. And we're also approaching camps with the same team through our events and venues work group, which I'm going to talk about in a second, because many other camps are hosted by institutions and other organizations that are not necessarily related to the K through 12. So we have started doing that for the last 2 weeks. And we do hope to continue doing that and make sure that we can have summer camps in a safe fashion. We have also started the process with the schools to plan for the fall. I know it's not even summer, but we do need to plan for the fall. So we have started that exercise already, and we will continue at the request of our schools. We'll continue meeting with them with a defined frequency, because we found that spending all of this time that we spend every week has been extremely helpful for schools as well as for us to better understand the needs of schools. So we're going to continue doing that. And That will be followed in the next week or two by an after academic year exercise. And we're going to go through and ask the schools, the staff, teachers, nurses, COVID team, superintendents. We have some surveys. We want to hear from them. How did we do? What did we do well? What can we do better? Lessons learned, as well as areas that we could all improve, because we really want to know. So as we go forward, we can be more effective. So that is happening in the next couple of weeks. We already have a draft of the first, it's basically a customer survey, focused on schools, because I think it's important to ask those we serve, how did we do? And can we do better? And if so, how do we get there? So I wanted to share that with you. And then lastly, I had mentioned the events and venues work group, which is something we started when we were in phase 2. And things have changed a lot in the last few weeks, but we continue to work with that group. And the goal was to bring everybody that has anything to do with events and activities in the community, whether it's small events from, I don't know, farmers markets to big events like Hope Fest, and make sure that we're working together in a way that we can be of assistance and we can be helpful to them. And the meeting today, we actually have Carol Carter from the Valley. She's going to talk a little bit about, she's the Center Place coordinator. She's going to talk a little bit about planning festivals and events during the COVID in Spokane Valley. And we've actually had Jared from the city. We've had a lot of people come and present, because one of the goals of that group is to share information and best practices and lessons learned. And we built a special site on our website, which is a database repository for all of these presentations, all of this information. So it's a one-stop shop, and it also includes all of the regulations, et cetera. So event planners and coordinators and managers and operation directors just can go there, click, and everything is there. They don't have to go and look in 27 different websites, because these folks are, pretty busy with realigning their activities every other day. The second presentation that we have is actually Melissa Paul from GSI, who's the director of the Agribusiness and Ag Expo, which is a really big event. Last meeting, we had Matt Santangelo from Hope Fest and a few other folks. She's going to talk a little bit about the Ag Expo before COVID, through COVID, and as we go forward, because a lot of lessons learned for folks in that scenario, particularly from these groups that have had to really think through how to do things a little bit differently. And there are a lot of things that we've learned in terms of just general sanitation and hygiene and health that will be helpful, COVID or no COVID, because it will be very helpful for everything from the flu to norovirus to, salmonella. It doesn't really matter. And our goal with this work group is to continue the work group, perhaps with a dosage frequency. And the reason for that is because we as an agency, we're here to serve, and these folks, we can certainly continue to work with them because health and safety for events is a very important aspect of the event, regardless of whether we have a pandemic or not. So we're already looking towards the future as we move through this pandemic and go into an endemic phase, like the flu, hopefully. So we can continue working with all of these activities to ensure that the safety and health perspective, anything that we can be helpful with, that we're helpful with. Because we built very good relationships in the last few months, and we want to keep those going, because I think it's important for the community. So with that, I want to stop and see if anybody has any questions for me. I don't see any. Well, thank you. And thanks, Amelia.
Yep, absolutely. All right. Back to Steve for any general incident command updates that folks may need to know.
Yeah. Hey again, everyone. So I'm just really going to provide a little bit of context. As a data guy, of course, I'm going to go back to data here when it comes to the vaccination. We've really had a chance to start digging into who is being vaccinated in our county and where we can put some focus. And so just for a little bit of context, we're really seeing that the age groups, over the age of 70 are highly vaccinated. Over between 70 to 80 plus, we're looking at over 83% of that population is vaccinated, which is fantastic, as they're the most vulnerable, and we are seeing declines in those case rates for those age groups. But when we look at the younger groups, we still have a long way to go for pushing. So as of last week, between 18 and 29-year-olds, 30% were vaccinated. And for 12 to 17-year-olds, even though we just opened it up, it was a quick rush. We're about 13% vaccinated. And then kind of those middle groups between 30 and 59, we're right around 40 to 45% vaccinated. So that's one way to look at it in areas that we're focusing in. Our communications teams and our vaccination outreach folks are doing a really great job trying to get more people involved and kind of shifting from this, you come to us, to we're starting to find that let's go get vaccinated where you are. So we're doing clinics and fire stations. We have one every day this week in a fire station throughout the county, as well as mobile clinics in our sheltering system. For geographies, it's kind of interesting to see that it's spread out pretty well. When you look at the areas with the lowest rates of vaccination, it is our rural communities. So Elk, Deer Park, Fairfield, Latah, those have really low rates compared to the city core. But we are seeing some areas within the county, in the city itself, that are a little bit lower, including like East Central, Logan, Meade, and then parts of the valley. So that's just a focus that we have. Again, we're trying to move more toward, as opposed to people coming to us, so with these mass vaccination clinics, us doing more targeted, thoughtful clinics to get folks vaccinated or give them the opportunity to be vaccinated. And then otherwise, as we said, this is still endemic. It's really going on. We do have cases every day, and we have a couple areas that we're focusing on. As of last week, our areas of highest concern were long-term care facilities. We are seeing increased cases in those areas, as well as childcare. So we did have, unfortunately, 8 outbreaks declared in childcare settings last week, and we're really focusing and working with those folks to close down the centers and work on their protocols, as well as working with the long-term care facilities. So it's still out there. We still have cases coming in every day, but we're doing our best to get a hold of it. And vaccination is really the route that's going to move us down in the direction we need to go. And that's it for me on that end.
Thank you, Steve. Looks like Scott. Go ahead, Scott. Scott Simmons.
Thanks, Amelia. Just a question for this group. Given the data is showing that the rural areas are lower in their vaccination rates, are we currently, or is there thought about creating some mobile clinics out in those outlying areas, say like a Deer Park, a Chadroy, down south in Fairfield, maybe at a grocery store, at a Grange, at a community hall, out in Medical Lake, out in different areas, just to try to make it more. I don't know what the challenges are. If it's accessibility, not everyone wants to drive down into the arena. It's a Monday through Friday operations. If they can't get out on the weekend, just wanted to get some ideas on thoughts to how do we get some penetration out in our rural areas, which may be having a more difficult challenge getting access to it.
Steve, you're muted again if you're trying to say something.
No, I was waiting for if anybody had any ideas. I think it's excellent. We are working on some of these mobile clinics and getting out there, but I think the more suggestions we can get and operationalize, the better.
I know for the city of Medical Lake, Mayor Mikey had the WSU teaching school come out and do a vaccination clinic at our local library. And we vaccinated 82 people, I believe, in, 3 hours. So I think there's a combination of access, but I think a lot of, I think we're getting to the point where access isn't as big of an issue as thought process or what. I mean, there's certain people out there that just aren't going to get vaccinated, don't believe in it, all those things. And so I think that's when you get trying to get to that 60, 70%, those are the folks that you're going to have to convince somehow, whether it's bribing or whatever. But I think access is probably right now the smaller issue of sort of the belief in, or the whether people believe or don't believe in the vaccine. I don't know how you overcome that part of it.
Amelia, this is Kelly. I did want to share with the team that there are clinics taking place with our county fire districts. There's one in Deer Park, Cheney area. I know that they're working on some of our southern county areas, zip codes. But there definitely are, and also Range Health, WSU Range Health gets out into the rural areas as well. And then, of course, remember that we have our homebound calls and those efforts taking place, and those are throughout the county, so not just in the city limits of Spokane. And then also, I know that we have so many, sometimes we forget about all the pharmacies that are participating. So your Cheney area, Deer Park, there are a lot of pharmacies and their hours extend beyond the 9 to 5. And even the Spokane Arena doesn't just have Monday through Friday hours. So I know that's not something we can rely on in the long term, because the state has spoke out about how they're changing their focus to more smaller targeted clinics than the mass vaccination clinics. But I mean, that is options for people to be able to get into town if they can outside of work hours. And then there are access points in our rural areas. And yes, we're still working on how to do that even more. But the county fire districts have been very, very helpful, because those fire stations are areas where people are comfortable and they know where they are. And those are community gathering spots traditionally. So, and they know the people in the fire departments.
I think that's all really, really exciting and really good information to have. The fire districts can be great partners with this. And I would imagine, as Doug mentioned, there's some hesitancy by certain people, but I think making sure that we've addressed all of the other barriers, such as transportation, such as the age that some of these folks are, presumption of availability on work versus non-work hours. Even if it's unavailable, but it's an inconvenience to drive 20 minutes into downtown or 30 minutes into downtown, by having something right there in their town or close by their town that they can access, it might just start to tick off some of these a little more quickly. So I think these are all really great things that are happening already, and the greater extent that we can reach out to those rural areas and make it known that the vaccine is located or available right in your area would be really great.
Yeah, and I think that the work is definitely heading that way to, take care of any of the inquiries. I get them, so does Dr. Velasquez, about, doing a clinic, a vaccine clinic in a certain spot. What would be helpful, I think, for the health district from this group would be, if you identify, or your organizations, as you're working with different groups and they're asking questions about, like, when are we going to get a vaccine clinic in one of these spaces, or how do I access? If you let us know that, we will do all the follow-up, because it just may be that there's, lack of information or communication in one of those areas. But, if anyone hears of anything, or, someone wanting to do a clinic, just let myself, Dr. Velasquez, Kelly, Steve know, and we get them immediately connected to the vaccine group. We have businesses doing that all the time. Just last week, I think it was Vino for Vax, some of the wineries looking at how they could be sites as well, and that picks up some rural areas within there. And Dr. V and I got them immediately connected into the vaccination team. So, please, any of those ideas are great to send our way.
Thanks for the reminder, Amelia. Sometimes it just helps to hear it again that your team is on it and we can bring some ideas to you.
Absolutely. Yep. Any other questions, thoughts, things that you're hearing that we need to be looking at the health district? I think, as Dr. V mentioned, we're really trying to look more in that endemic and proactive phase right now of how we can anticipate major events, school in 2021. Commissioner CUNY just put a good a comment in there about Fairfield Flag Day community event. Commissioner, if you have someone there we can connect with, please send their contact information to us and we can take care of that. Any other final things before we wrap up? All right. Well, we will see everyone in 2 weeks. And thank you for all that you're doing to help the health district as we continue to respond to COVID. So thank you and have a great week.